Hi, we love getting your questions on social media, and today's question is about combining treatments. What is safe to combine together at your same aesthetic medicine appointment, and what treatments are better separated by different appointments? This really depends on what treatments you're planning to have, what areas of the face you're going to have treated, what depth that treatment is going to be aimed at, what your tolerance for discomfort is, and how new you are to aesthetic medicine treatments. Generally, for somebody new, we go really cautiously. We do a single treatment, and that could be something like botulinum toxin, or it might be a skin booster treatment, or it might be a very subtle enhancement with dermal filler. But generally for new people, I would say do a little bit, sit tight, wait and see if you like it, and then go back and consider something else if you want to. And generally you should get a plan from your aesthetic practitioner, and that, in my opinion, should be a doctor, dentist or aesthetic nurse, because they'll give you the best results, in my opinion. If you are feeling really a bit sensitive, or you're premenstrual, or you've got a lot going on, I would say don't overdo the treatments and just space them out. Go easy on yourself. People ask me if treatments are going to hurt, and we do everything we can to keep them as comfortable as possible. But if we're using needles on the face, there's always a chance of bruising and there's a chance of discomfort. So really plan around what you'd like to have done. There are some treatments that are okay to blend together. So for example, I might do a little bit of botulinum toxin and I might do a skin booster at the same session, because I'm treating different areas of the face. But if somebody's looking for treatment like botulinum toxin around crow's feet lines, and also something like polynucleotides in the same area, I wouldn't combine them, because number one is you don't know which treatment is giving you the benefit and which is giving you the best bang for your buck, and also going forward what's going to be a good treatment for you. So if you combine them, sometimes you don't know which is giving you the benefit. And the second is, if you had a complication, and they rarely happen to everybody, then you don't want to be unsure which is causing the complication. You want to know what's happening. There are other treatments, for example, say we are using skin pen microneedling. We know that the result of that is going to be that the skin looks red, the blood supply is increased in the skin, because we're causing a micro injury to the skin. And I'm not going to put in a medicine like botulinum toxin at the same time, because that extra blood flow from the skin pen, although it's temporary and lasting a few hours, could theoretically wash away some of that toxin away from the precise locations where I want to put it. So certain treatments are not good together. If I'm using something like a toxin, would I do lip filler at the same time? Potentially, but it's always looking at that person's tolerance. And if you have an event planned, a wedding, a big dinner, a family event, it's always looking at spacing your treatment well in advance of that, because we absolutely can't promise you won't get a bruise. People say to me, oh, I didn't bruise the last time, I'm going to be fine, aren't I? And I've got a lunch date in 2 hours. I really think just be very cautious. They are medical procedures. There's always going to be some risk of bruising or swelling or tenderness. And if you've particularly had dermal filler, we strongly recommend no makeup that day, because we've got little holes in the skin from the needle marks, and we don't want makeup or hands or pets licking your face or anything getting into those little tiny holes, because that filler material could be there for years. We want it to go in cleanly. We control the hygiene side of it, and then we ask our patients to control the aftercare, where they're not putting on makeup and they're being really cautious over the following 24 hours to let everything settle down. Treatments like facial peels, again, you can combine them. If you're treating the face, go ahead and treat the neck or treat the hands, and ask your practitioner in advance if you want to combine treatments. We all lead busy lives and we want to be as efficient as possible, but there are certain things that are best checked in advance. If somebody's got a cold sore, even if it's dry and it's healing, we don't do injectables at all on the face, because any injection, even if you've got a cold sore here and you want toxin here, any injection can trigger activation of that cold sore virus, which stays dormant over many years, and we do not want to cause any infection elsewhere on the face. So if you're in doubt, ring your practitioner and find out in advance. If you are expecting zero downtime, and that's partly our industry's fault, we've said these are lunchtime procedures, do ask in advance if you've got a big event so you can plan it in time. We never do a first treatment like dermal filler if somebody's got a big wedding that weekend. It's asking for trouble, and sod's law, they'll be the one who gets a bruise. So arm yourself well with the facts, ring up and find out ahead of time, and we'll always give you that information. Take care, bye.